I guess that's what January does, Steve. Thank you.
Well, it's official. The flu is now an epidemic in the capital region.
Yeah, local ERs are swamped, we're told, and doctors and nurses just trying to keep up with all those sick patients. Albany Med, Ellis, Samaritan, Albany Memorial, Glens and Saratoga hospitals, they've all put visiting restrictions in place as a result of this. And a patient can have only 2 visitors in their room at any given time. And then children under the age of 12, they're prohibited from visiting altogether, as they're the ones who are more likely to have and transmit any kind of respiratory infections out there. It's all in an effort to help prevent the spread of the flu, and Jennifer Lukey has been speaking with local doctors today. And Jen, what about it? They're just getting jammed, aren't they?
Yeah, they're swamped, and it's just getting worse from what they tell me. The flu is now in every county across New York State. There are now thousands of cases of it here in the capital region. ERs are packed, urgent cares are packed, and in most cases, if you get it, there's not much doctors can even do for you.
People are not only coming with flu, but they're getting really sick with flu. And the volume of people that are coming in is much over what we were taking. To give you an example, Christmas Day we saw 80 or 90 patients. The next day it was more like 140.
And since then, the numbers have continued to go up.
And it's been sustained. It's almost like someone flipped a light switch after Christmas and said, come on in, it's flu time.
If you come to the ER here at Samaritan Hospital with flu-like symptoms, they're going to ask you to put one of these masks on and clean your hands before you go into the waiting room.
That's not only to protect others, but the staff, many of whom have been hit with the flu themselves.
It's not something that comes on slowly with the sniffles or something. You can literally be feeling fine and an hour later feel absolutely horrible. It's abrupt onset.
County health departments have been swamped running tests, but many local ER docs say at this point, if you've got the symptoms, you've got the flu.
I'm amazed at the number of people that come in really looking sick that when you ask them, did you get your flu shot this year? And they say no. And it's like, yeah, the flu shot wasn't a great match this year, but it does mitigate some of the symptom severity.
If you're one of those people, it doesn't matter your medical history, it isn't too late to get the shot.
We're seeing it across all the age groups. From infants through the elderly. Most of the people that are ill enough to be hospitalized are over the age of 50.
Unless your symptoms are severe, there's really not much that can be done for you in the ER. You've just got to get through it with lots of fluids and rest.
Now, I hate to be the bearer of bad news here, but to make matters worse, I'm told there's also a pretty nasty GI bug going around as well. So that's adding to wait times in the ER. Again, the ER is triage based. Those who are the sickest are seen first. At this point, if you've got flu-like symptoms or this GI bug, depending on the severity, you may wait hours to be seen. Liz.